It's Thursday, December 3rd, and welcome to the New York Amsterdam News Podcast. I'm Cyril Josh Barker. My guest this week is State Senator Kevin Parker, who's going to be speaking with me about the bill he's introduced that would declare racism a public health crisis in New York State. He's also going to be speaking with me about racial inequalities during the COVID-19 pandemic. State Senator Kevin Parker represents New York's 21st District in Brooklyn. He recently introduced a bill that would declare racism a public health crisis. Senator Parker believes racism continues to cause a lack of resources and opportunities for communities of color, leading to long-term negative effects that have plagued families for generations. This includes inequalities that have been exposed during the COVID-19 pandemic and the recent police killings of George Floyd and Breonna Taylor as examples of how racism is taking the lives of Black Americans. And right now he's with me on the phone to talk about these issues and several others. Welcome to the podcast, Senator Parker. How are you?
I'm great, Josh. How's everything going?
I'm doing great. Thank you so much. Well, let's talk here about this bill that you have about declaring racism a public health crisis. And I think that we've actually heard this before about how racism kills us. And we've seen examples of that over the summer. We're seeing that during the COVID-19 pandemic. But I want to hear your thoughts on why we need to declare racism a public health crisis.
Yeah, absolutely. W.E.B. Du Bois is famous for saying that the problem of the 21st century is going to be the color line, right? And so it was such in the 20th century, it is such in the 21st century. And so I introduced S8673B, which is a bill that asked the Department of Mental Health in the state to declare racism a mental health crisis. And further, the bill goes on to construct a working group to come up with some equity-related solutions. I think it's not just enough to identify the problem or to even declare the problem, but we have to start working on these problems. And so when we start talking about what racism is as a public health crisis, it really is everything from things like the murder of George Floyd and the kind of violence and disproportionate, excessive use of force that we see in Black and Latino communities, to microaggressions that many of us who are African American, Latino, Asian, Muslim are experiencing every single day. And I think that it's important for our state government to address those issues. And I'm hoping that this bill becomes law so that we can do it in a more formal and systematic way.
Absolutely. And I want you to talk about those police killings that we saw, those killings that we saw over the summer of George Floyd, Breonna Taylor, and Ahmaud Arbery. You mentioned them specifically, and also the ACLU and Black Lives Matter, who are all calling for an end to systematic racism. Those are just examples of how racism is killing us. But I just want you to talk a little further about how law enforcement and those police killings are really impacting our community and why it's a public health crisis.
Yeah, I mean, we are seeing this, again, not just in the state of New York, although that's what I'm trying to address. We're seeing it as a national epidemic. And you saw protests, not just nationally, but internationally. Again, not just about, Ahmaud Arbery and George Floyd, Breonna Taylor, but there's just so many people that we've seen here in New York, not even starting, but certainly most notably recently with Eric Garner. And so we really want to, create a dynamic in which we're addressing those issues. And so I've introduced a number of bills that deal with police reform that we believe provides accountability and transparency to the police department, but also provides some alternatives to what we're seeing. So I also have a bill that, creates a non-police response to mental health and homeless crisis, right? And so we need to do that kind of thing. But I think, kind of sticking with the issue of, racism broadly, we see everything from labor market discrimination to housing discrimination, to attacks of people, not just by police, but even, you had Asian people being attacked by groups of people at the beginning of the COVID crisis, because we had a president who was walking around calling it the China flu. And so you had random Asian people, not just Chinese, being attacked because they felt that this pandemic was caused by them. And that is certainly racist, and that's certainly the kind of thing that we need to fight against as a state government.
And you also mentioned that a historical continuous lack of resources and opportunities for people in communities of color are impacting our health as well. Can you talk about that, especially when it comes to COVID-19?
Absolutely. Part of the systematic racism that Blacks, Latinos, Asians, Muslims are experiencing every day is systematic in the way of how resources are given out for things like education. And right, so look at schools that are predominantly Black or predominantly Latino versus white schools. Right. We see the same thing in healthcare. And so the COVID pandemic has ripped the ugly scab off of a festering wound of social determinants of health, right, and social inequality that have led to things like food deserts in Black and Latino communities, right, that then lead to things like diabetes, high cholesterol, high blood pressure, that lead to things like heart attacks. You see, before this viral pandemic, we over the last 40 years have been suffering disproportionately from HIV and AIDS as we are just in the wake of World AIDS Day on December 1st, right? And so no matter almost what major health crisis you look at, Blacks and Latinos are disproportionately suffering from that. You're certainly seeing that with COVID. I passed a bill that now became law earlier in the year that directs the Office of Health Disparities in the state of New York to do a study on the impact of COVID-19 on Black and Latino communities. And we're seeing that African Americans and Latinos are disproportionately affected, both in terms of getting critically ill, hospitalizations, and ultimately death. And certainly upstate New York, you're seeing the same thing with Native Americans. You're seeing it nationally with Native Americans as well, who all begin with a certain levels of pre-existing conditions, right? We already walk into this crisis with the highest levels of hypertension, high cholesterol, cancer, HIV and AIDS, right? And then we go to get health, and we are victims of health disparities. What does that mean? That means that we are being misdiagnosed and underdiagnosed from many critical elements. And then once those kick in, we are then in a dynamic where we are the frontline workers. And so we had to go to work when everybody else was being told to stay home. So African American Latinos disproportionately are the people operating buses and trains. They are working in grocery stores, right? They are the front lines of the hospital workers. And so they can't even get away from the virus. And then they go in, once they contract the virus, then go home to the most crowded conditions in terms of, the New York City Housing Authority and some of the other high density communities in which Blacks and Latinos live, many of which in poverty. And then when they get sick, they then have to force to return to the same healthcare professionals who misdiagnosed them and underdiagnosed them in the first place. So it's become a vicious cycle and a perfect storm of disease and then death.
And you also talk about some statistics about life expectancy in the Black community, and something else that's often not talked about, but we're starting to see a conversation more, and that's the lives lost of the lives of Black women that are being lost to pregnancy. Talk a little bit about that, and you also mentioned again life expectancy, but also the rates of how police are killing our Black men as well.
Mm-hmm. Well, again, the issue of excessive use of force has been something that we've been talking about, for Amadou Diallo. I mean, we can go on and on. Michael Stewart. I mean, the names are long, unfortunately, and it's only really now that I think that we've gotten the proper response from government with the state legislature, dealing with some of that. I have a bill that's based on the California model that actually defines excessive use of force in the law. I have another bill that eliminates qualified immunity for police officers. I have another bill that I think is going to be really, really important from the context of providing residency for New York City police officers, right? Like, I think all of these things provide the kind of accountability and transparency that we need in law enforcement across the city and across our great state. And we can't forget in this conversation Black trans lives, right? Because, disproportionately, we're seeing particularly Black women and Latino women of trans experience also being victims of murder, not necessarily by the police, although there too, but also in the community. And so, like, when we talk about Black Lives Mattering, Black lives can't matter until Black trans lives matter, right? And so we have to make sure that we are protecting all members of our community as we continue to fight for equity in our communities. And so I'm hoping that this work group that we're going to put together is going to start to both identify these various areas in which we're seeing white supremacy bear itself out in the context of whether it's excessive use of force by police officers, violence from civilians, whether it's housing discrimination, whether it's health disparities, whether it's food deserts, whether it's violence against trans people in our community. We need to look at it all, and even microaggressions, which things like calling 911, which is why I passed the 911 false reporting bill.
Yes.
And I think that we need to continue to look at all of those dynamics, and then more importantly, come up with some solutions that we both in the state government and we as communities can take up to address this plague on our society.
All right. Well, you've made it abundantly clear to me and to everybody else about how racism is becoming lethal or is lethal to the African American community and other communities of color. And you talked about this working group that you want to do with the New York State Commissioner of Health's office. You've laid out the issues. We know it's clear what's going on. How is this bill going to help change things, and what's this going to ignite if this bill passes?
Mm-hmm. Well, we just introduced the bill last week or a week before last, something like that. Made some edits to it. I'm happy to have this opportunity to talk about it. I think that public discourse is the first part of the agenda-setting public policy process. I'm hoping that it will be picked up in the Assembly and that we'll get co-sponsors and certainly people who are interested in this to reach out to me and work with me to help get my colleagues on board. I'd love to have, memos of support from organizations like the NAACP and the Urban League and, the Hispanic Federation, right, and others across the state, and people of goodwill who understand that this is a serious problem. And then we hope to move it through the Senate, through the Assembly, and then get the governor to sign it. And then, again, work with the Department of Mental Health, to start, to make this declaration in law that racism is a public health crisis. And then, convene a working group that starts addressing these issues. And certainly people who might want to serve on that working group, people who want to work with our state government, to do this important work, should reach out to me. And I'm happy, with all the help that we can get, because this has been a long time coming, and every day that we don't start addressing this is more lives lost, is more people suffering, it's more people standing in the breach.
Very powerful. I want you to go back a little bit and talk about COVID-19. I know that, as you understand, the city is going through a second wave, or is preparing to go through a second wave, whichever you want to call it. But tell us about some of the issues that are being faced in your district, in the 21st district, that you're seeing when it comes to COVID-19.
Yeah, I mean, there's actually kind of a myriad of issues that are kind of heaped on top of each other. We're in the midst of a number of kind of dueling pandemics. We have the pandemic of COVID-19, which exists, obviously, of course. And again, we have people being sick. We have people dying from that still. But then that has created an economic tsunami in our community that has left literally thousands of people out of work. And without income, you have a lot of people who can't feed their family. And so we're seeing food insecurity on top of the poverty. And then in addition to that, we're seeing, again, people are, trying to make a way. And so you're seeing higher levels of crime in our communities, shootings, but also things like robberies and muggings. I mean, we haven't seen muggings in the city in decades, and now we're seeing that, people's cars being broken into. And adding to that stress, you have schools being closed, and so people who even may have an opportunity to go to work can't necessarily make it to work because childcare, right? And then again, you're nervous about where you're going to send your child
Right.
because the pandemic is out there. And so you have people who even have an ability to make money being stuck and not being able to address that need. And we certainly, as another area that my office has been looking into, and we're looking at a program that would pay parents to stay home with their own children.
Oh, wow.
Almost,
Please
yeah,
talk to us about that.
yeah. Yeah, I mean it's kind of a notion I've been thinking about for a while, because it will give you money, it will subsidize childcare
Mm-hmm.
so that you can take your child and send them to a stranger. Why would we not give you that same money and just say, here, you stay home and take care of your child,
Okay.
right? Understanding that a person staying home with their own child, maybe having the same kind of or maybe even a better impact in terms of the bonding of those children and the rearing of those children.
Yes, yes.
And so one of the other things that two other things that we're seeing is we're actually seeing, as we talk about children, a lack of calls around child abuse. And we don't think that child abuse actually disappeared during the pandemic. We just think that the other eyes that were on children are not there, because children aren't going to schools. They aren't showing up at clinics and not seeing social workers. And so we're kind of afraid of the level of abuse that may be going on with children during this period. And then we have, with our stay-at-home orders, have did something that is kind of unintended consequences of locking people who are victims of domestic violence in with their abusers.
Mm-hmm.
And so we have these domestic violence survivors who are literally locked in, and oftentimes, and so we've seen actually calls go up nationally over 30%.
Yes.
And we know that domestic violence is underreported. So we can imagine how much is happening, given the stress of the times, given the lack of income, given the people having be caught in close quarters. And we see larger numbers in Black and Latino communities. We see it larger in immigrant communities. And these are other ways that racism plays itself out in our society. And these survivors are not getting the same kind of attention and the same kind of access to resources in these immigrant communities, in these Black and Latino communities. And we need to address it. And so this is some of what we're seeing now during the pandemic. Again, I've asked the Office of Health Disparities in the Department of Health to look at this. We're now asking the Department of Mental Health to step up and to declare racism a public health crisis. And then we really are looking for some solutions and the address of these issues by the state government, and hopefully by every agency.
Yeah. I've said many times during this pandemic, two things. One, for a lot of people, it's rained, but it's now pouring for a lot of people, because all of these issues are coming to a head. The financial issues, the health issues are all hitting hitting some families and some communities at the same time, and they need help immediately. And the other thing also, of course, is that the pandemic has exposed so many disparities that were already known, but they were exposed even further when the pandemic came. So we're talking about, the racial disparities when it comes to health, the digital divide we're seeing in our schools also, which is something that's awfully important when it comes to education in our city. What I think about you in this bill, I think it's great that, we talk about a lot of issues when they happen. But what this bill does and what you're doing is you're dealing with with the root issue of these problems rather than dealing with them later, because I think it's a lot easier to deal with them beforehand, before they even start, rather than dealing with the aftermath. And so that's what I think that this bill does and what you're doing. And I think it's really amazing. Final word from you. What's the goal here for this bill? Let's look ahead to the future. It passes. What's the goal here for this?
Well, the goal is to, one, have a conversation about racism as a public health matter, and for people to address it in a very serious way, and for our state and city governments to address it as a very serious matter. And that's one of the things you just talked about was the issue of the digital divide. As the chairman of the Energy and Telecommunications Committee, it's been one of the things that I've been kind of leading the charge on, trying to close. And our digital divide now is a two-part digital divide. One is the historical digital divide that's been around the access to devices. In this very moment, we have a stay-at-home order We have kids who are doing distance learning, and many of them don't have tablets or laptops and doing their homework on smartphones.
Right.
That's insufficient, and it's a real problem. And then we have the new digital divide, which is the access to broadband. And this is problematic both within the context of education, where we have young people who are being told to do distance learning and don't have access to Wi-Fi. But it's a problem for adults as well. Many of which who've been sent out of work and now can't even look for a job properly because they don't have any access to high-speed broadband. And so it's certainly one of the things that we need to continue to work on. And so I'm hoping that the state legislature passes this bill in both the Senate and the House. I'm right now talking to some people about being assembly sponsors of this bill, and hopefully they'll put the bill in and we'll get some of my colleagues to be on board. I'm hoping that the community gets involved with this and that people will reach out to me and we will, put together a team of folks to lobby on this important issue and to continue to raise the clarion call that we need to address racism in all its ugly forms.
All right. Well, listen, Senator Parker, thank you so much for coming on the podcast. We really appreciate it. Thank you so much.
Thanks for having me. Take care, Josh.
That concludes this week's podcast. You can pick up the latest edition of the New York Amsterdam News on newsstands and get updates online at amsterdamnews.com. You can also keep up with us on Facebook at NY Amsterdam News and follow us on Twitter at NYAmNews. I'm Cyril Josh Parker. Thanks for listening.